My name is Dr. Anamika Joshi. I'm an oculoplasty specialist practicing in Hyderabad. So oculoplasty also deals with the watering apparatus of eye, and I have experience in dealing with at least 500 to 600 DCR cases. So today I'll be talking about what is the post-operative care that you should take after your DCR surgery. Now, if your DCR surgery is done under local anesthesia by an external route, so here are the precautions for the same. Usually after DCR surgery, we keep our patients in the hospital for around 2-3 hours, and after that we can discharge them. That means you need not necessarily compulsorily stay in the hospital overnight, but this can differ from surgeon to surgeon. For me, my patients, I admit them for 2-3 hours, and after that I discharge them on the same day of surgery. In the DCR surgery, we put a cotton in the nose because in the surgery we have some bleeding from the nose. That is normal. In fact, it's a good sign because we have made a new pathway. So for one day we keep one cotton in the nose, and that is why for one day you need to breathe from the other nose. It is usually patients don't really complain about it, and next day morning itself we remove the cotton from the nose. Next thing, if it is done by external route for you, there will be some sutures here that will be seen, and there will be some swelling there, which is normal after any surgery. That post-operative swelling goes in around 2 weeks. So in about 90% of the swelling in 2 weeks it will completely be gone, and maybe the rest 10% will take 1 month to go. So for around 2 weeks, you will be asked to do wound cleaning. That is over the sutures. You need to keep those sutures very neat and tidy with the cleaning that your doctor has advised you. You should avoid splashing water on your wound because water acts as a source of infection, and you should not touch that area without washing your hands, or even otherwise you should just touch it only for cleaning. So usually 1 week to 2 weeks we ask our patients to avoid head bath and take bath only below the neck, and the face can be cleaned by a wet clean cotton, and the sutures have to be cleaned only by the betadine solution or the septic wipes that we give to the patients. So wound cleaning you need to take care for around 2 weeks. In some patients we put a tube inside the eye, and the tube basically connects the eye and the nose. So you can have slight feeling of itching because of the tube, and once you remove the tube, which we generally do at 1 month duration after the surgery, all that itching, everything will go. Sometimes if you sneeze very loudly, or if you sneeze a lot, then you can see that tube coming out of your nose. So don't worry, your doctor will gently put it back. So you need to take care that you don't sneeze much, or you don't kind of cough too much after DCR surgery for few days, so that your tube remains in position. Also, don't try to pull the tube. From here, you can see the tube little bit. You have to avoid pulling the tube if it is placed for you. Other than that, there are not many restrictions in what you can eat or drink. Please eat a very good healthy diet after your surgery for a better post-op recovery, and there are usually no restrictions except for avoiding spicy food for maybe a week. If you eat too much spicy food, that can irritate your nose because the surgery is essentially done in the nose area. So the spicy food has to be avoided. Apart from that, too much of dust has to be avoided. You can go outside into a park or those things, but if it's too dusty environment like agricultural fields and all, for some time, at least 2-3 weeks, you should avoid such places. First and second day, we advise our patients complete bed rest, that is on the day of the surgery and the next day, so that there is not much bleeding from the nose. But after the third day, that means from the third day onwards, you can resume your routine work and you don't require any further bed rest. So these are the precautions that you should take for your DCR surgery. And if you're planning this surgery, you can always consult us, or if you have any issues with your post-op care or any things that have to be taken care of, please visit your oculoplasty surgeon. Thank you.